The apparatus above is called a spirometer. It is used to measure the lung capacity during breathing. Human lungs have a volume of about 5 decimeter cube, but in a normal breath, only about 0.5 decimeter cube of air will be exchanged. The spirometer has 2 tubes, one for entry of pure oxygen from an air chamber to the man through his mouth. The second tube passes the expired air from the mouth to the chamber. Valves in the tubes ensure that the oxygen and the expired air pass through the respective tubes. Select labels. What is the use of the nose clip? Answer: to close the nose so that breathing is done through the mouth. All expired air will be collected in the air chamber. Click Expire. Look at the animation closely. The man is expiring. What happens to the lid of the air chamber when the man expires? Answer: the lid moves up as expelled air from the lungs enters the chamber. What happens to the tracer? Answer: a pen traces a line upwards. As the man expires, the volume of the air in the chamber increases, resulting in the tracer moving up. Click Inspire. Now, look again at the man who is inspiring. What happens to the tracer when the man inspires? Answer: a pen traces a line downwards. When the man inspires, air is taken in. Volume of the air in the chamber decreases, and its lid moves down. The movement of the lid coincides with the breathing movement. During expiration, the line moves up, while during inspiration, the line moves down. The movement of the lid is plotted on a grid paper on a rotating drum. The graph is called kymograph. Select normal breathing. The animation above shows a man breathing at rest. At rest, each breath moves a tidal volume into and out of the lungs. This is the volume of air exchange per breath, keeping the blood, partial pressure of oxygen, and partial pressure of carbon dioxide within a normal range. How much is the tidal volume? Answer: 0.5 decimeter cube. Move the cursor to point P on the graph and click when a hand appears to check your answer. What does each peak on the graph represent? Answer: each peak represents one breath, that is expiration and inspiration. How many peaks do you expect to be traced per minute from a healthy person? Answer: 15 to 20 peaks per minute. Click Forced Breathing. Now, look closely at the graph when the man forces out as much air from his lungs without exercising. How many forced breaths did the man do? Answer: 3 breaths. What is the maximum volume of air exchanged during forced breathing? Answer: 3.5 decimeter cube. This maximum volume of air exchanged during forced breathing is the vital capacity. Move the cursor to the point R on the graph and click when a hand appears to check your answer. This measurement, which averages 4.6 decimeter cube in young men and 3.1 decimeter cube in young women can be clinically important, since an abnormally low vital capacity may indicate damage to alveoli in various pulmonary disorders. For example, emphysema is caused by cigarette smoking. A vital capacity has two components. First, the maximum volume of air inspired, and secondly, the maximum volume of air expired. These are called the inspiratory and the expiratory capacity respectively. Move the cursor to the point S on the graph and click when a hand appears to check your answer. How much is the inspiratory and expiratory capacity respectively? Answer: 2.0 decimeter cube for both. If breathing is insufficient so that the blood partial pressure of carbon dioxide rises, the person is hypoventilating. And when the partial pressure of carbon dioxide is abnormally lowered, the person is said to be hyperventilating. Out of the vital capacity, 0.5 decimeter cube is the tidal volume. The difference between the inspiratory capacity and the tidal volume is the inspiratory reserved volume. This is also true for expiratory capacity. Select label. How much is the inspiratory reserve volume? Answer: 2.0 minus 0.5 decimeter cube equals 1.5 decimeter cube. During forced breathing, the total exchange raises up to 3.5 decimeter cube. But not all air from the lungs is forced out. The volume of air that remains is called the residual volume. How much is the residual volume? Answer: 1.5 decimeter cube. What is the total lung capacity from the graph? Answer: 5.0 decimeter cube. Summary. Spirometer is used to measure lung capacity. By this apparatus, the breathing movement is traced in a form of graph called chemograph. Human lungs have a total capacity of about 5 decimeter cube of air. In a normal breath, about 0.5 decimeter cube of this will be exchanged. This is the tidal volume. A healthy person breathes about 15 to 20 times per minute. During forced breathing, the volume of air exchanged raises to 3.5 decimeter cube. This maximum volume of air exchanged during forced breathing is a vital capacity.